Hello and welcome to Arab Health Week 2021. I'm Dave Sharp and I'll be your host and moderator for the next couple of days. On the third day, my colleague Sandra Garlick will be taking over. But for the next couple of days, I'll be guiding you through the programme, and what a programme we've got for you. Now, this is a perfect opportunity for you to collaborate, to learn, to innovate, to connect with all of your colleagues, not just in the United Arab Emirates and beyond, but worldwide. We've got people joining from all over. So you can chat using the chat box, which is there on the right hand side. And of course, for our speakers, you can ask them a question. So all you need to do is click on that Q&A, pop your question in there. You'll see other questions as well. If there's one that you really like the look of course, you can vote on it. It'll nudge it up. And that way we'll make sure that those questions get asked after the presentation. So if you want to chat to each other, say hello. Tell us where you are, what the weather's like, and what you're doing, what you hope to get from the next 2 or 3 days, and just generally network. This platform provides you with a fantastic opportunity to connect with each other. But of course, you can also come off the platform later on when the event is finished and connect on social media as well. To do that, we suggest that you use the hashtag Arab Health Week. You'll find that hashtag on Facebook, on Instagram, on Twitter, on LinkedIn. And by following that hashtag, you'll be able to find each other, keep the conversation going, and keep sharing best practice ideas and all of the other things associated with this fantastic few days that we've got for you. There is another hashtag as well, which is Health Week Series, because this is just one in a series of events. So you can use that one as well and stay connected over the next few months. So let's take a little look at what's coming up this morning. We'll have very shortly Sumit Puri, who'll be talking about health tech, keeping up the momentum post-COVID. He's our first session speaker. And then later on, we'll be going to Dr. Farida, and she'll be talking about shaping the healthcare sector in United Arab Emirates. Dr. Farida Al Hassani will be with us. So why don't we just get on with the show, as it were? I mentioned there our first speaker is Sumit Puri. Sumit is going to be talking about the momentum that we need to keep up post-COVID. He is the Chief Group Technology Officer from the Evercare Group, and here's his presentation.
Good morning, everyone. I'm Sumit Puri here, from Evercare Group CTO, and I'm basically here to talk to you about health tech, maintaining the momentum post-COVID. The key agenda, the consumer age. We all understand how the world has changed in front of us over the last year and a half. What is the need of the hour? What should be our strategy going forward, especially when we talk about healthcare institutions? How does typical institutions, traditional institutions transform themselves? How do we really engage the consumer differently? And what are the learnings I have had in my journey over the last several years on this? So again, moving on, if I look at really this age of the consumer, this is really in some sense a very difficult time for healthcare. We all understand the pressure we are in, huge amount of demand for services, shortage of beds, many developing countries, shortage of vaccines, huge challenges. And at the end of it, the consumer is actually expecting more. He wants us to be responsive. He wants us to be in many ways efficient, effective, balancing safety with convenience. That clearly is the need of the hour. And for us, we do get a little bit more kind of a difficult situation with the fact that now we also have Dr. Google to assist the consumer. Sometimes the patient knows more than the doctor, at least he believes to know more. And then it complicates, the life of a doctor when he's trying to advise him on certain things. So it's a tough environment. And the overall kind of expectation is to really work in harmony, work in conjunction to help us solve this complex, environment. So it is about building a consumer insights-driven organization. It's about understanding the business value, how we could really leverage technology, how do we differentiate our services, how do we really become much more effective at reaching out at some point, in fact, reaching out to consumers before they have to reach out to us. How do we really enhance overall experience? I think that's the need of the hour. If you look at the consumer focus, and I'll just go back to one slide just for reference, the patient has become the new center of gravity. And hospitals are just one of the many providers in the ecosystem. So you actually have now care which is virtual. We have people working from home now. We actually have home care happening. You have a lot of ancillary services that are coming in. Pharmacy delivered at home, wellness clinics coming up. There are rehabilitation centers. Huge amount of focus that's now happening on the entire ecosystem. And the patients are informed. They're savvy. They watch social media. They see what is happening there. A lot more, word of mouth publicity that basically can impact the reputation of our healthcare institution very rapidly. Now, how quickly we can go down. In that sense, it is about convenience. It is about reduced cost. It's about improved outcomes. It's about enhancing processes and personalized care. It is about making that consumer feel important, making the consumer know that we are doing the best for him. And that to me is important. In many ways, if you look at the environment today, we are flooded with data. There are massive amount of healthcare data being generated at multiple sources. And if you consider the top 5 companies in the world today are all data companies, Amazon, Google, Facebook, all these key companies, they all basically are leveraging data to enhance the consumer experience. They're really making sure that we can consume that data and then they further, personalize that experience to us. And that's what healthcare institutions have to do. We are the cusp of a revolution, a cusp of changing the way healthcare is delivered to the consumer. And that is what we need to kind of orient ourselves towards, because only those who basically are able to do this will survive. It is going to be a very, very tough battle for survival as we go forward into the coming decade. So again, if I look at the real objectives here, we do need to have a connected, coordinated, and integrated ecosystem with the patient in the center. You're talking about possibly connected devices, wearable devices which can be portable. You're talking portable insulin pumps. You could also have, internally embedded medical devices like a pacemaker. You could have, various ways in which you could also further assist the hospital services, by just, kind of staying connected with patients while they're at home. There's a huge amount of work that could be done with telehealth, really kind of having the doctor reach out to you, reach you in your homes, in the comfort of your homes, without you having to basically step out to an infection-prone environment, outside your homes. So there is a huge focus now on integrating this entire ecosystem. And for that, we've seen, there will be a need for more out-of-hospital digital services. It will basically be a lot more of self-management along with the doctor and, of course, the hospital institutions, kind of combining to create that integrated care, that continuum of care for the patient. And to us, the key proposition for any healthcare institution is to establish quality with convenience, quality support, quality protocols, ensuring that is done along with continuity of care, where the silos start getting to come together and you reach out to the consumer where he needs you. In some sense, if you look at the home healthcare, 70% of healthcare needs can be met at home with 30% better recovery. It's only the tertiary and quaternary care that needs to be done in the multi-speciality hospitals. Of course, you need to follow protocols. Of course, you need to be very, very well, integrated and engaged. The doctors and the nurses or the paramedics engaged with your recovery path. But 70% of healthcare needs can be met. And frankly, almost 20 to 50% lower cost of treatments if we consider the treatment to happen at homes versus the hospital. We know that there is a significant amount of negative backlash that comes to us when we basically are not able to offer that convenience, the kind of waiting times that we basically have consumers, have to undergo. They are busy, they have multiple things on their mind. And if they're made to wait for a discharge, made to wait to get admitted, made to wait to basically even see a doctor, it does have an impact. 82% of patients, after one bad experience, we've seen, research has shown, do not sometimes visit that institution again. Now, these are scary numbers. We have to be in some ways a hospital with a difference, healthcare institution with a difference, because the patient is basically expecting treatment like what they expect in a typical hospitality sector, which is very tough because the healthcare institutions are in strain. That's where technology has to come in to really enhance the value, enhance the kind of reach, enhance the kind of access, enhance the protocols for enhancing the quality of care. There is a lot of confidence of global market trends. We all see the state of mental health with COVID, even without COVID, by the way. If you look at, a couple of years back, we had a study from WHO which said by the 2030, 1 in 3 people are likely to get clinically depressed because of the stress we live under. COVID has only, in some ways, even further aggravated that risk. We do need to also look at some unspecified, subtle kind of indicators to help enhance the wellness of those patients. But before the patients, I think even more important is your own employees, because an employee-centric strategy will lead to patient-centric strategy. If you look at nurses, you look at doctors, you have to have them in the right state of mind. High attrition rates in nurses, we've seen what damage it could cause to the patient care. In many countries, we've seen almost 40 to 50, 55% attrition in nurses. If you look at even doctors, they are under huge strain. And they do also want some level of respite from the constant barrage of pressure and criticism that they are subjected to. Of course, if I look at the bright side, telehealth adoption is on the rise. We are able to make some more headway. And I have seen myself, in the last couple of years, we were pushing doctors to embrace technology, over the last few years, and we did not see too much traction. But now, what I've seen, in fact, in the last almost a year, 6 months, besides, we actually have doctors chasing us to get, onto the telehealth platform, because they want to be connected to the patients. They want to reach out. And to me, that's a plus, because we can obviously then leverage this to enhance the quality of data which the patients can provide us to help us offer better treatments to them. There's significant opportunity that exists if you're able to leverage these technologies for the betterment of the patient care. So it's about the marriage of people, process, and technology, which would really help us enhance the quality of care. Again, if you look at it, frankly, patients are not only the ones that come to the hospital. We are also talking about potentially healthy patients, which could slide into that kind of patients requiring surgical interventions. You have lifestyle-related diseases that have gone up tremendously over the last few years. So it's not about what is on the surface. It's also basically digging deep within to enhance wellness, to provide continuum of care. I think enabling holistic and integrated healing, that's what is required. And multiple aspects involved there. Mental health, psychologists kind of coming together, nutrition, wellness packages, personalized treatments, a lot of things which need to come together to really, really enhance that quality of relationship with the consumer. And in some sense, it's also important that we consider that this will be kind of, in a ways, added to, if you look at the overall, way it is basically interspersed with SMAC, with, multiple aspects that are basically happening, the social media, the mobility, the kind of things that we are seeing in front of us with cloud and analytics. There's a lot of work that's basically happening outside what you typically see. Because, even the interaction we have with the consumer, we only sometimes see one interaction we've seen in the hospital. There might have been interaction with the consumer in the call center. There could have been an interaction maybe, at a clinic. And of course, on social media. We don't really know what all has basically gone into that engagement of the consumer. There is a lot of growing use of mobile devices. There's a significant amount of tech-savvy patients that are coming to the fore. We are now talking about the digital natives, people who basically have grown up on technology, not the old, people who basically have been forced, not the digital immigrants or, of course, the digital illiterates. It's the new technology-savvy patients who basically will kind of come to the fore over the coming decades, over the coming years. And we have to be ready for that. And we have to embrace technology. Work with technology, not become its slave, but work with it to actually enhance that experience. And this, to me, is what would actually help you to stand out in the mind of the consumer. Of course, IoT applications, the way we basically are leveraging, the AI is also going to play a part. But we know that these all trends need to basically converge for the betterment of the patient care. If we see this over the next 10 to 15 years, we do see a lot of focus on productivity, but slowly but surely, we will start moving towards more value, consumer-centric healthcare ecosystems, cutting-edge health orchestrators who will actually help consumers coordinate and convene. Frankly, I don't even see the competition for hospitals coming from hospitals itself, healthcare institutions coming only from hospitals. You might have huge competition coming from the likes of Google, coming from the likes of Amazon. They are really kind of trying to use the data to reach out to the consumer in a totally differentiated and personalized manner. And we have to orchestrate, given the fact that we have doctors, we have a body of knowledge on the consumers, we have to start putting it together, creating a much more integrated experience. What I have seen, and I must say this, in my previous role at Max Healthcare, we actually saw, the IBM India head came to me and said, "I'm not going to leave Max ever." And I said, "Why?" He said, "Look, the last 15 years, my entire family, my mother, my wife, my children, myself, we're all basically having the complete medical records with you. And that's what probably, will make me keep coming back to you. Because you know me, you understand me." I think that's what we need to get to. At Evercare also, we're doing the same. We're basically trying to create that personalized experience to really, be able to connect to the consumer, understand him better. And that's what we really need to do going forward. So the problem, as we know, from an individual consumer standpoint, it's lack of private access, lack of instant access. They are looking at convenience. They are looking at now, the service to be provided to them. Limited choice of services that they see in front of them. They don't know whom to go to. There's also a significant amount of siloed approach. They might have multiple, conditions, but typically we only see one specialist. If you have a kidney problem or also a heart problem, you would typically will not be advised, that holistic treatment. You do need to go to two different specialists who might give you conflicting medicine. And that's a problem, many ways. We also are seeing higher cost of services, much more diagnostics being done, which are unnecessary sometimes. Of course, there is a lot of precaution that hospital institutions take to help you, help enhance that patient safety. But it is something which is difficult to do. It's a balance which you have to constantly strive for. And with the paucity of time, that becomes difficult for a doctor and a healthcare institution. So from a provider perspective, we all know we need to enhance client experience. We all want to ensure improved outcomes. We'd like to, scale the business, in some sense, where you can reach out beyond your hub, move out to spokes, to smaller centers, and, get the specialist to, connect with the patient. And of course, reduce your cost. So these are all real issues which the industry, which the healthcare institutions are grappling with at this point. So the need of the hour, clearly, is for a solution that's holistic, that's preventive, and that's universal. Much more personalized. It offers a much more integrated way in which we can treat the person. It is about the person. It is about the consumer. And we need to put all these things together and focus on wellness, focus on prevention, not only on the cure, because that comes later. If you're able to build a relationship for life with the consumer, with his family, they will not go anywhere. You will always have the share of the wallet. But you have to start investing in that relationship to create something which is basically a co-created journey, for the patient. And technology today is what could help you in that journey. We've seen the kind of expectation that patients have about service quality and efficiency. We've seen the need for accountability and transparency from the regulatory agencies, the demand for clinical data. Every time I keep hearing from my doctors, I need more data to enhance my treatment protocols. And I keep telling them, if you enter data, you will get quality outcomes. If you enter quality data, you will get the right outcomes, right information, right MIS. If you don't enter data, whether it is in e-prescription or it is in the electronic health record systems, you might have a problem in ultimately getting the kind of MIS, the kind of research information that you really want. And that's where there is a partnership required. There is a need to kind of look at overall, the investor's viewpoint. We have to also balance that with the patient's interest, because that's critical. We have to ensure patient is still at the center. But at the same time, the interests of other stakeholders are balanced. And the key thing here is to get those insights at the right time. Real-time analytics wherever possible, or at least the timely analytics which is required to enhance the quality of our decisions. Again, if I look at the technology innovations, multiple technologies currently at play. You have so much that's currently happening, so many innovations that are happening. They're simply still not, in a way connecting together. We're not kind of still having some level of integration done with these amazing innovations. But the time is not too far before we will see, somebody taking the lead and bringing these together. We've got teleophthalmology, we've got mobile ventilators, we've got multiple, robotics also now coming to in a big way. Huge amount of, innovation that's happening on robotics. Of course, now mind-controlled wheelchairs. We've got these, innovations from individuals. Once institutions come together, research institutions that are already working today. I mean, if you look at, frankly, even the COVID times, the two companies that really in some ways transformed the vaccination were startups in a way, biotech and Moderna, which supplemented the pharmaceutical big majors. And that's the need of the hour, to balance agility with the kind of traditional body of knowledge we already have, to balance that and create a holistic whole, kind of really a line of treatment which will assist the consumer in a faster recovery. Industry trends, we have to become more customer-centric. We have to optimize. We have to adapt to the context. We need to be sure this is what would work for you. In Evercare, for example, we actually had, when we were doing the telehealth solutions, in multiple countries, we launched the telehealth solution for India, Pakistan, Bangladesh, Nigeria, Kenya. We saw there was a difference in what worked well in certain geographies. Not everybody, it's not one size fits all. In Kenya, there was a bandwidth issue. When we launched the same platform, we did it very quickly, by the way. But there was need to, make it more adaptable to the context, make it work for them. Bangladesh, we had amazing teamwork. We saw huge traction. In fact, our OPD, volumes with teleconsult remained almost constant after the first 1 or 2 months of COVID because of telehealth coming together in conjunction with the hospital teams. Same to some extent for India. But we did have some challenges in some of the other geographies like Kenya or, for that matter, Pakistan or Nigeria, which is just coming up that time. But I think we have to make it suited to the context. Horses for courses. I think that's important because that's what will help you get the traction from the consumer. And the focus on prevention and holistic wellness, besides just the curative care, because that's what builds relationships, in many ways. So there has to be a focus on the ecosystem. We have to make sure that these aspects come together. The customers, our partners, selecting the right partners, getting the right things, getting the right devices. We've done bike ambulances which had point of care diagnostics, which actually allowed patient, to be, in fact, of the bike ambulance to reach the patient in 15 minutes, in Max, for example, and we could save lives. The point of care diagnostics was so important and had to be accurate because, information is being looked at by a command center, by the clinical team, besides, of course, the operational team, which are helping them in the logistics, making sure that they can reach the hospital in time. But those things, those devices also need to be clinical grade, need to be, reliable, and they need to come together. And of course, our employees who are at the center, make sure they are connected, they're engaged, they're fully, owning some of these aspects, because only then will the actual experience be enhanced. And all of this needs to be done with a very robust data and analytics platform, which is so critical to be able to do some course corrections as required as we go along, because it's important. Sometimes you might make a mistake, but then as long as you can correct it while the patient is in hospital, that's the best thing that can happen. We don't want those unhappy customers to go out, and announce various, issues on the social media when this problem could have been addressed very quickly while he was still in hospital. And that's something which is doable. It's possible. There are some small mistakes that can be quickly corrected because healthcare institutions are under pressure and they actually handle a lot. So some simple aspects, some simple nudges in the right direction using analytics, could really enhance both the delivery of care and also the experience of the consumer. So to really kind of look at this, how do we really get all this together? We will need to do things differently. We will need to lead people differently. We need to build platforms differently. We need to buy our products or services differently, select the partners differently. We might actually look at multidisciplinary teams to enable integrate care across specialties. We have to start looking at all these aspects to be actually working in harmony, working synergistically with each other, because only then will be able to provide personalized care to that patient. So in some sense, and I'm borrowing this, from Gartner, it actually says we need to look at composable healthcare thinking. We need to really look at what do we need to do in terms of much wider communication and engagement activities to bring our teams together. We have to evaluate where experience needs to change, because unless the people, process, and technology are working, synergistically, you will not get the full impact. So you have to review the current portfolio. What are we doing? How do we change? How do we enhance? And this will be possible by forming fusion teams. In some ways, it's about breaking the walls of departments. You actually have to bring them together. You actually need to create teams that are focused on consumer centricity, creating a team which is focused on consumer experience, really looking at specific aspects that need to be improved, and obviously corrections that need to be done in that journey without their own siloed objectives, whether it's finance or it is legal or it is IT or it is operations. We need to come together to really create a really strong, robust, solid experience for the consumer. And in some sense, this can be done by actually having a command center. We saw this happening in a bike ambulance, for example, where we had a command center. We are seeing this in the home care that we are launching, at Evercare, which is basically about looking at all information together in a very seamless manner, which transfers information from various spokes, and you're then creating a very strong protocol to deliver care. So integrating these aspects of people, process, systems, making sure all of them basically understand the objectives, the people understand the objectives, understand the metrics, and continuously refine the process, and obviously deploy the right system, because we have to ensure from a system standpoint we do have all the necessary MIS available to these teams to measure themselves, and if they measure, they will definitely manage. They will definitely be able to improve as we go forward. So a shared culture, shared ownership, where IT delivers value in partnership with clinicians and the operations team. We are looking at really creating shared goals, because that's what will give you the real impact, real benefits. It's not us versus them. It's all of us together, where IT needs to play a significant role, but it has to work in conjunction with the clinicians and with the operations and other employees, other support functions, to deliver the best possible experience to the consumer. It's about coaching teams. It's about creating that learning culture. It's about making it some level of empowerment, enabling digital literacy. It's also about being patient with the nurses, for example. When somebody comes in new and maybe they might have a language problem, you might need to have a buddy to help her. You might need to have a small e-learning platform which could help the nurse understand the protocols. You might have a simulation center, which could be used to enhance the quality of the training. Maybe a normal kind of skilled nurse could become an ICU trained nurse with with some level of simulation training and some level of patience, some level of hand holding with the senior nurses or the doctors. It has to be done together. As Stephen Hawking says, intelligence is the ability to adapt to change, and change we see all around us. Today, working from home has become a reality. Today, we know telehealth is not going away. It will stay. It will be more and more popular as we go forward. We know there will need to be a lot more integrated, personalized treatments given in a contactless manner. We don't want too much of contacts to happen given the risk of infections and all of that. So we have to adapt. We have to change smartly. I mean, today, if you look at, there is a lot more intelligence in our smartphones that what we used to ever have as an individual. And we have to leverage that intelligence from wherever we basically feel there is value and make it come together. Enhance the quality of training, enhance the quality of literacy, and be a little patient in terms of bringing them up together to improve customer experience. So add those e-learning modules, give them some 5-minute nuggets, the concept videos, enhance the classroom trainings if required. We can do a hybrid model where the classroom trainings can be supplemented with e-learning and some practice sessions which at their own pace. Those aspects are critical because healthcare institutions need to be supported by the government, by the regulators, by, of course, the consumers. They are under pressure, and we do need to support them as healthcare administrators so that they can really kind of be able to provide the best quality of care without getting too stressed during that process. So again, if I look at the key aspect here, it is about employee platforms. It is about enhancing collaboration. It is about alignment, understanding those metrics, understanding the challenges or concerns they have and addressing them, and making sure that we basically are clear about the goals, about the key objectives of each function or each of the overall enterprise on certain aspects, whether it is patient safety, whether it is convenience, also from our perspective, costs, because we do need to bring down costs, we do need to enhance quality, we do need to also enhance and improve convenience. But it has to be done in a manner that basically works synergistically, across, and not at the cost of the employee, of the employee well-being. We do need to also take care of that employee who's working so hard, 2 shifts sometimes, more than that, to help take care of those patients, the doctors and the nurses who are doing a phenomenal job in all this. So use that platforms, to kind of help you make some necessary changes or corrections as required to enhance the quality of well-being of our employees. The essential of today's digital business is, of course, managing the diverse workforce. It is about being agile. It is about managing compliance. It's adapting the new technologies, whether it's cloud or it is automation or new IT, IoT devices, and also controlling cost. That, to me, is a tough ask, but it can be done if we are able to follow a very graded, very sequential, or some ways, well phased out path towards digital health. We have to manage that transition in some level of with some level of care. We look at how technology can supplement, how we can basically get the people and process to come together. We have workshops, we have discussions, we create some integrated teams, which will then help you in enhancing that quality of care. So that's, to me, critical, because we do need a lot more alignment, a lot more discussions, a lot more workshops, which would really be extremely important as we really create a world-class experience for our consumer. GCC countries and UAE, there's a lot of possibilities. There's so much that's working for you. There's so much that basically is kind of is good about the infrastructure we have. We have a fair amount of technology savvy consumers. There are good quality doctors. We are trying to make sure that we can bring all these things together and partake of this journey in a manner that is achievable. We have set short-term goals. We do have a long-term roadmap in mind, but we set short-term goals and basically try and work towards achieving them with clear metrics, which would really be useful as we kind of undertake this journey. So in some sense, when we even look at the overall expectation from our hospital managements, we would like to basically able to have a 360 view of the customer. What interaction he's having, how the call center interacted with him, what kind of engagement did he have with the sales teams, or what happened during the interaction that they had in the hospital front office or the billing counter. We have to, in some ways, make our patients our fans. We have to, in some ways, build a relationship, enhance that loyalty, clearly become, the institution of choice for our consumer, for our customer, for our patient. Not only patient, by the way, it's also the attendant, because most of the experience is also experienced, as actually also seen by the attendant. The patient is sometimes too, kind of stressed about his treatment, and the actual service is more kind of observed by the attendant. So we have to look at these aspects carefully, and sometimes, make sure that those corrections can happen while the patient is still in the hospital. Or of course, even if it's, let's say, home care, we're able to basically then make those improvements in our protocols, even at home if necessary. So again, this is a important element in terms of tracking the key metrics, tracking those touch points, which would help us enhance the overall experience. So we do need to think about a BI unit, business intelligence unit, that can help us capture the data on operational excellence, on clinical excellence, on our financial efficiency, because ultimately the costs need to be managed. I mean, hospitals will need to basically ensure that the bottom line is in order. So we have to look at all these aspects, and getting near real-time insights is really the key to ensuring much more sustained and much more profitable business results, because that will help everybody, including the consumer. We will want it to be a very healthy institution and cut down costs that are not necessary, obviously enhance patient experience, reduce the kind of time that they are having to spend in the hospital, the ALOS, the average length of stays, use the assets more optimally. Maybe, somewhere we actually look at different models as well, operating models. Those are areas that can be looked at. Even excess inventory can be, kind of reduced by having right insights. We can actually look at, readmissions. What are the reasons? How do I enhance the quality of care or cut down on my medication errors? What happened? How do I really kind of at least look at Pareto analysis, saying the top 20% issues that happened last month, let's make sure those 20% are solved. Those are key areas, which we could probably explore, which could actually enhance the entire, continuum of care, for the patient. And of course, like I said, also it might be useful for, the families, extended families, and, the entire ecosystem around them. So I'll not spend too much time. There are various metrics we could look at in operational efficiency, the supply chain, the experience of our staff, experience of our patients. How do you ensure that those aspects are properly tracked and monitored and necessary corrections made? We could look at the turnaround times, for discharge, etc. Clinical excellence, also need to start measuring outcomes. Very important that we know what we did right and what we did wrong. Sometimes we might go wrong. And it's fine to basically, get that understanding so that we can correct it next time around. I mean, that's what at least I do in my team. I say it's fine to make a mistake sometimes. We're all human, but as long as we don't repeat it, or at least do our best not to repeat it, we are fine. There has to be a culture of acceptance for people to bring out an issue that happened and make it, really, better, make the whole process better, make the entire protocols better. That's only happening with a culture of acceptance. So work on those. Start measuring it properly, and then I'm sure there is going to be improvements seen across sectors, across the spectrum. And if we have the right data, if you're following standards, whether it is ICD-10 for diagnostics or it is CPT for procedures or any of that, you will start seeing data playing a key role, technology playing a key role, AI. As we mentioned, frankly, smartphones, they're so smart today. You look at Google, Dr. Google, you have so much that could be basically, collated in the intelligence of a million doctors, is actually in your smartphone. So vis-a-vis, let's say, one single doctor, you could have that augmenting the doctor. You could look at personalized, precision health. You could look at, a much better genomics, mapping. You look at, various ways in which we could probably assist, the consumer in his analysis, in his diagnostics. There are various aspects that will come together when you actually have the proper smart use of data, following the right standards. And it's important that we have some of the insights coming at the right time, which we can then leverage. If you look at just a high-level snapshot, of some possible uses of AI in healthcare, they're actually saying that you could clearly, in many of these aspects, you look at it, they say, of course, you could, actually reduce 8% of your healthcare expenditures by predicting and measuring, monitoring patient outcomes. You could optimize your staffing by almost 30% if you do a good job of knowing where the additional resources are put and where you probably have slack. You actually have overworked nurses. There are nursing rostering systems. You might have some places where a nurse is looking at 10 patients per nurse, and some might be quite free. They didn't get a patient the whole day. So there has to be optimization of resources or resource allocation, and same for assets, the biomedical equipment, etc. So AI can help you get that understanding, get to those insights. Similar to that, augmenting diagnosis. Doctors do not have time to spend on going through every single symptom you had over the last 50 years, 40 years, 20 years. You basically been facing a particular chronic condition. But you could assist them. You could use AI to enter this information in the system, and the AI algorithm could help give some predictions on these possible diagnoses, which the doctor can use. It is augmenting the doctor. It's not replacing him. But you could really do a huge job. They're saying 30 to 70% cost savings can happen if you reduce the prescribing of ineffective drugs. Just the diagnosis was correct. Obviously we had a fair amount of support provided to the doctor at the time of diagnosis, at the time he was seeing the patient in OPD. So you already had some information that was entered by the patient, and the doctor was able to then quickly make up his mind on what should be the line of treatment. And of course, we could automate various intervention mechanisms, and obviously make it a lot more personalized with a lot more focus on what would be the best treatment protocols. So again, there is significant opportunities in this entire journey which can be leveraged across. Now, if I look at basically the way we can use AI, there are areas we actually have significant opportunities again which are actually available. Now, if I look at the way we actually have used AI also in spend analytics, we could use the AI for improving the procurements. We could use AI for enhancing the kind of time that the patient is spending in terms of his waiting times, etc. We enhance the quality of care in certain specific touch points. There are now devices that can actually assist you in image analytics, AI and radiology. We've done so many pilots. They're excellent. I remember I went to a conference in Amsterdam a few years back, and they was mentioning almost 85% accuracy in AI on radiology. Just that the remaining 15%, some of it was very wrong, which is why the radiologists were still not willing to use it fully. So it just requires some level of training, some level of hand-holding by correcting those errors and making the machine understand, the machine learning algorithm understand what needs to be changed. A typical radiologist looks at 70% accuracy. The machine is already giving you 85%. We could leverage this. We could enhance this by giving the right training, by giving the right guidance to that machine, and the algorithms. And I'm sure the overall kind of efficacy will improve for everyone. The cost will reduce, and obviously the diagnosis and the actual treatment will improve. And now we see a lot more of this bots and conversational AI coming to the forefront for engaging consumers. Because sometimes we see patients do not actually feed this information if it's not a very serious issue. You'll probably find a gynae, let's say an expecting mother, very willingly feed all the information you need. You'll find, a heart patient entering all the information you need, or a cancer patient, but maybe not so much diabetic guy. He will not enter the diet he took because it's not that engaging. Now there are tools that can help you enhance that engagement, make it simpler, make it easier. It is about the experience. It is about design. It is about intuitive interfaces. Making sure that the patient, the consumer, is able to engage with the technology in the way he does, let's say, an iPhone. Make it easy. Make it actually, useful for him, and obviously, the right kind of insights, right kind of information that he can understand. And the same thing goes for the doctors. I mean, Babylon and many others of these technologies. they're all augmenting the doctor. They're making the patient enter information, and that's what helps the doctor, get much better diagnosis. I mean, we've seen the third largest cause of deaths is the wrong diagnosis, which is sometimes done because of paucity of time. With bots, with conversational AI, you can actually improve that significantly. It's very, very possible, and we just need to work together to leverage technology in the right manner. So with all this, I think we can really create a longitudinal patient record. We can actually create a complete ecosystem, complete 360-degree view of the customer from a patient's DNA all the way to their consumption and lifestyle habits, which would help us partner with them in their wellness journey. We create an ecosystem, we create a wellness kind of ecosystem that actually makes the customer being our consumer for life. We actually kind of really create that bond, that relationship, which enhances the way we basically interface with our consumers. So to me, it's about technology, it's about the process, and it is about the people coming together and making really the consumer at the center of all the delivery models that we typically give them. And that's how the entire ecosystem, the entire healthcare delivery model will transform and become a lot more useful, a lot more sustainable, a lot more happier for the consumer. Aspect I just like to highlight here is the key learnings also, which I think I kind of wanted to mention just from all the last several years that I've actually had experiences in various hospitals. It is about standardizing, the protocol, standardizing also the kind of, procedures and diagnosis that we do. It's about collaborating as per context, horses for courses. In some ways, it's about ensuring that there's a very adaptive and iterative culture of innovation. So you might actually have separate design teams which work together. Like I said, employees who are engaged. You might have a mixed, kind of team, which also, gets some of these upstarts, some new college graduates, some really tech, wizards to come in and partner your traditional teams to create that culture of innovation and embrace that culture of innovation. It's about outside and patient-centric design. Partner with startups, get the startups to work on the design. Maybe the traditional IT companies might not be experts at the user experience. Use the startups to help you in the experience aspects, in the UI UX. Make sure that adoption is the key. You measure what you actually have delivered. Is it being adopted or not? So there's strong governance that actually comes in, which will help you in terms of enhancing the patient experience. So in some sense, it is about creating a lot more focus on what users or consumers will actually start using, start consuming, start embracing, and creating your processes, creating your employee kind of interactions to that context. And make sure that you basically are in this journey for the long term. You create a culture, you create a culture of partnership with your employees and of course with your consumers, and enhance the quality of healthcare delivery. So that's all from my side. Thank you again for the patience.
And I'm delighted to say that Sumit joins us now for some questions. Hello, Sumit. How are you today?
Very good. Good morning, Dave.
I have to say that was a very positive and hopeful outlook that you've painted there. But we do have some questions that will perhaps test you a little. You speak about bringing these partners together, about innovation, about the potential for the future. But is the funding and the supply chain there? Does it exist, or do we need to build that, or is it robust in some areas and not so in others?
I think we will need to build a lot of this, and this can be done collaboratively with the right set of partners. So I think it's a journey. We will need to kind of engage with these partners, engage with some of our key stakeholders, and then co-create it. I think that is, to me, the key.
And do you think that there are partners? I mean, you mentioned some of the startups. There's some partners that you would like to see at the table that currently are being ignored or aren't being consulted?
Yes, I would think, again, like we all know, change is scary sometimes. We don't want to, look at moving out of our comfort zones. Sometimes, we realize that there is value in different way of thinking. We look at, I mean, I think I'm mentioning this, we look at in the COVID vaccination also, two startups, Moderna and Biotech, they were the ones who, in a way, took the leap of faith and kind of, helped co-create the vaccine with the traditional, powerhouses like Pfizer, etc. But I'm saying it's important to partner, with some of these innovative, companies, and obviously give them the benefit of your data, the benefit of all your insights that you've accumulated over the years, and then create a very powerful, kind of offering for the consumer. So it is about knowing what probably would be the most appropriate kind of using and kind of partnerships that we might have to forge, and then create something which is basically of value to the consumer. So I would say that no, we have to be open-minded about these these partnerships.
And not only the partnerships, but of course the tech. I mean, you spend a lot of time talking about the technology and the potential for technology to be part of the solution. But of course, that can be fraught with danger as well. The tech doesn't always work. You've got to measure. You kept making that point about measurement and data. How do you trust the data? Presumably, we have to measure over the long term.
Absolutely. I'm saying tech is not magic. I mean, we can leverage tech the way we want to. The smartphone can be a boon and also a curse. We know the challenges, we actually have with it. You don't have a spare time and all. But I really feel, we do need to understand that digital transformation is basically about not just technology. It is about process. It is about people. We have to kind of understand the various moving parts and bring them together. Sometimes it's easy to blame the tech. We feel tech is the panacea for all problems. It can solve everything. It needs support of the people. Even to train tech, even to train an AI engine, you will need training. You will need to, kind of partner with it. So I would just say it's important that we kind of understand these aspects and then, kind of do this, iteratively and collaboratively to deliver the best value.
And of course, there are some challenges with tech, with cybersecurity particularly. What do you see as needing to be in place to make sure that data and the tech is protected?
Look, I mean, there has to be a proper incident response. I mean, we know the kind of cybersecurity threats that are emerging across the globe. There will obviously be protection that we can enhance and, obviously, mitigate the risks as such. Network security, our endpoint security, all of those, those are there. But you might get hacked. We all know. I mean, the saying is 50% of people know they're hacked, but the other 50% don't. Something or the other has happened, with the growing, army of cyber attackers and stuff. What I would really encourage and recommend is focusing on incident response, quick and effective incident response. You will have an incident, but you should be coming out of it very quickly and effectively. That's what the focus should be. And get those key people together who can understand the challenge and quickly address it. That to me is most important. So work on your defenses. At the same time, ensure your incident response is very quick, very effective, and very pronounced.
Well, as I said, as we came into the Q&A there, you're very upbeat, very positive about the future. It's good to hear. If people want to watch your presentation again, they can watch it on Catch Up on the Future Health YouTube channel. Sumit, it's been an absolute pleasure chatting with you today. Thanks for joining us. Thanks for the presentation and enjoy the rest of your day.
Thank you so much, Dave. Thank you.